You do not have to gamble, even though we're here in Vegas. You don't have to gamble to figure out what is the best way to handle vasectomies, or should you do the consult and the vasectomy on the same day, or should you do the consult and then the vasectomy on another day? We're going to talk about that right here. I'm here with Dr. T.J. Morris, who's from Utah Urology. Is that right?
Yep.
Okay. And I perform vasectomies, a lot of vasectomies, and he does probably even more now in Utah. I have the patients come in, I see the patient, and then the patient will schedule for the procedure on another day. Whereas Dr. Morris, he does the vasectomy and the consult the same day. So I am really interested in hearing his workflow, his process, and how he gets it working so well. Thank you for discussing this with us.
Yeah, no problem.
Okay, so patient calls in and says that he wants a vasectomy. Walk us through how that process goes.
Yeah, so my staff will take the call. They'll start talking to them about the procedure, answering any questions that they have. My staff is very well informed. They know vasectomies in and out, so they're able to answer all those initial questions right from the get-go for the patients.
Before you go on, do you use any technology or any shortcuts, or do you is there anything on your website that shortcuts that phone, the talk track? Because that could be a long conversation with somebody on the phone.
Yeah. All of our information is on our website, vasectomypro.com. And from there, it goes through the whole procedure, frequently asked questions, cost, insurance information, risks, benefits of the vasectomy. And when they're ready to make that decision, right on our website, there's just like a 4-line thing. They just fill out name, phone number, email, and what they're interested in, and they just push send. That sends an email right to my staff, my office, and they call them back and schedule the vasectomy.
So if they come in through your website and you drive that vasectomy patient to your office to make that to send that message, that conversation is a lot shorter and a lot easier than someone who doesn't know anything about you, who calls because you're a urologist who wants a vasectomy.
Right.
I assume that maybe your staff will have that patient maybe go out to the website and look at that first?
Usually they've already read it, but we do redirect them to that. There's a new patient packet on our website that they fill out before coming to get their vasectomy procedure, and it's also there's pre-vasectomy instructions and after vasectomy instructions on the website as well, and patients do great. They really want to know, they want to be informed, and so I'd say 95% of patients have really read through the website very carefully before they even come in. So they come prepared, ready to rock and roll.
Okay, your staff contacts them, works out a time that's agreeable for the patient to come in, and are there instructions that you have them come in? For instance, for me, I always wonder about sedation. Some people may want diazepam or Valium. Some people may want nitrous oxide. How does that conversation go? Where does that conversation come in during your patient?
Just when they come in, our patients, they don't need it. You know what I mean? If they do need something, we offer nitrous oxide gas that they can sign a consent form, then get the gas, before, they're actually under influence.
So the patient comes in and they don't, pretty much you don't tell them about diazepam. What if they inquire?
If they inquire about it, like they really want to do it, then we say, well, that's something that needs to be done beforehand. It is a controlled substance. You'll need to meet Dr. Morris first before he's able to prescribe something like that. That way we would do a consultation in person with me.
Okay, so that will be one instance where you would see the patient beforehand.
Yeah, we allow them to do it the same day, but if the patient prefers, absolutely, we can do it separate.
I'm thinking logistically, if I prescribe the medication, I instruct the patient to take the medication about an hour before, which means you have to see the patient, prescribe the med, and then have them go pick it up and then wait another hour, or how does that work?
Yeah, that's very rare. You honestly do not need that.
I agree with you.
For this procedure.
I'm just thinking logistically.
Guys walk out of there saying it was worse to get my blood drawn than to get a vasectomy. That's truly what it is. The nitrous gas, if they really are nervous, that's all they need to really calm their nerves and get them where they are comfortable.
How does that nitrous okay, so the patient goes through the website, signs up, now shows up for his appointment, and where does the nitrous oxide conversation come in?
So from the check-in, the receptionist, again, we're doing 50 vasectomies a week. These girls, and they know vasectomies through and through, and so they just talk with the patient and offer it. Say, we do offer nitrous oxide gas as an added benefit. If you'd like to have that, we can give it to you.
I like to really hear that talk track and how they. I think you already said that most of the patients choose to have nitrous oxide. Is that correct?
Yep, I say most.
Yeah, same with my experience. Most patients choose to have nitrous oxide, and I think it is a great benefit to the patient. But the talk track has to be there somehow. So I have to maybe call your front desk and pretend like I'm a vasectomy patient and hear the talk track on about the nitrous oxide. So,
and then I will talk to him as well. I mean, before we do anything, we have a face-to-face full evaluation, consultation before anything is done.
okay, so that's the next step. So the patient, you do the usual intake form and information. Usually these are healthy guys, and they're roomed, and then you come in and talk to them.
Well, the MA, I mean, again, these girls are very well versed. They know this through and through. Okay, they do so many a day. They go through the whole packet with the patients. They go through the specimen cups and the instructions about we wait 3 months and 20 ejaculations. Then they're going to ejaculate into one of these cups, take it to any LabCorp in the country. And we get patients from Alaska, Texas, North Dakota, Nevada, Idaho, from everywhere. We even had a guy flying from Chicago that morning and fly back to Chicago that night.
No, you're doing something right.
So LabCorps are everywhere, and so we've chosen to use them just because they are everywhere. We give them the cup, the order form, and say, here you go, take it in 3 months. They send the results to us. We then call you with those results. Until they hear back from us that there's absent sperm, they need to continue contraception until that time. And there's also, we have a card. It goes through, today, off your feet, laying down in bed, feet up, just relaxing all the rest of the day. Tomorrow you can go back to work if you have a desk job, and then slowly increasing your activity, but then nothing strenuous for a week. So all these instructions are on a card that we have. They're all on the website, but then we kind of concise them, kind of the bullet points on this card that we send them with, okay? And then the MA goes through it with them, and then that's pretty much it. With the MA, they go through the whole, of course, history of present illness, the past medical history. We ask a lot of questions about, how many kids do they have, how long have they been considering this, do they understand this is considered permanent, make sure that they're doing this for the right reasons. We want to make sure that this is a procedure that they don't regret in the future, and make sure we get fully informed consent about possible risks, complications of a vasectomy.
Okay, so you see the patient, you examine them, and then he, of course, decides to have the procedure, and then he is placed in a separate procedure room?
Yep, I take him to the procedure room, and we perform the vasectomy right there.
All right. Less than 10 minutes later, he walks out, and he gets the instructions. And I assume hopefully most of them perform the semen analysis afterwards, and then you call them with the results. What do you do when the patient kind of disappears?
Yeah, I mean, that's their choice. I mean, we've informed them heavily that this is something that needs to be done. Until I clear you, you're still fertile.
Do you have any post-vasectomy follow-up calls if they don't perform the semen analysis, or do you just say the informed consent up front is enough, and if you choose not to follow up or perform the post-vasectomy semen analysis, it's on you, the patient?
That's correct.
It's the latter.
The latter, yes.
Okay, so I do something different. We still chase them down and try to get them to comply, but maybe something that we'll have to revisit. Mm-hmm. Yeah, so for me, it's the usual. They want a vasectomy. They visit the website, not as comprehensive as yours, and then they make the appointment. We do the intake. The MAs room the patient, pretty much fills in most of the HMP it's templated. And then I will see the patient, and the only considerations will be, any anatomical challenges or any complicating medical issues. The last decision will be diazepam or nitrous or both. Mm-hmm. And then the patient walks out to the front, schedules the procedure with nitrous or without nitrous, typically with nitrous. And then the patient comes in the next time. I perform the procedure under nitrous. The patient walks out, and we give them the instructions, follow up specimen jars, requisition forms in a bag at that time. But that initial evaluation, they're handed a comprehensive 4-page handout about what to expect, and then there's another separate 2-page handout on post-op things that they need to do. Good. So that is just comprehensive. But I think your idea of putting it on the website and having it available, and then be able to capture the patient's information and have your office initiating that call might be something that other practices can consider doing if they want to increase whatever business that they're trying to increase.
Right, yeah.
So, all right, we are here we just finished the AUA coding seminar here in Las Vegas. This is not your first seminar, I know.
Absolutely not.
Yeah, so how many times have you been here?
I think this is my third time at this specific conference, but they're very beneficial. I mean, everyone on this network, I mean, you've kind of, talked about these seminars, and amazing. I came in here thinking, oh, what am I going to learn?
That's exactly how I feel too.
But yeah, I learned tons today. I mean, a lot, just from, meeting with these people, talking with the person sitting next to me. She's the head biller of this big urology group in Austin, Texas, and started talking with her and gave me ideas right away. And so I learned a lot from the speakers, but also from the peers that are here. I mean, I learned a lot at these conferences.
Yeah, and I've been attending these conferences for many, many years as well, and sometimes more than once a year, and I always take away something. And if not for the interactions with the attendees, it's also information from the speakers and the presenters, even though sometimes I'm on stage myself. So, all right.
That's actually how I met you, actually.
Yes, it was.
That was my first year out of practice, and I had asked a question, and then you approached me, because I was doing something very unique and different, like you've done, being a solo practitioner, which is very rare. You should have saw the eyebrows I got today from people like, "Oh yeah, and what kind of practice?" I'm solo, like, what? And so these things are very beneficial, especially for guys like you and me. Yeah,
believe it or not, I got the same reaction 10 years ago when I said, yeah, I'm starting a solo practice, or I'm in a solo practice. And everyone's reaction is pretty much the same, and they can't believe it, or they kind of think, I can tell by their look, well, you're not going to last long. That was the impression that I received from them. But attending these seminars definitely has been beneficial for me as a solo practitioner. I think it's also beneficial for pretty much a lot of the attendees. The reason I approached you is because every time I come to one of these things, I know there are people who know more, and I know there are people who know less. And you're just starting out, so I wanted to make sure that you succeed as a fellow urologist. So I always try to provide as much value to you as the attendees, and including you at that time. So I'm glad we connected.
Oh, I'm forever in your debt, to be honest with you.
So what do I always tell you? Once you make it
forward.
Pay it forward.
That's right.
All right. Pay it forward, everybody. If you guys have any questions, comments, please leave them below. Let's talk vasectomy. Let's talk about coding and billing and seminars and things like that. Hope you all have a great rest of the weekend. Take care.